touch the inside of my packaging because, again, I want to keep that sterile. Whenever I put my gloves on, I do not want to touch the outside of my gloves. They are cupped to where I can actually pick one up by the inside of the glove. That way, whenever I am suctioning her, I have not introduced any microorganisms to her body. Okay. Okay, so I am sterile gloved now. Now I can reach in and get my catheter here. Since I am sterile, this is what's actually going to be inserted into the airway here. I'm going to move this out of the way. Now I'm going to attach my suctioning, and it's careful to note that this hand is no longer going to be sterile because I'm going to be touching this device here. So I'm keeping this one sterile, and this one will no longer be sterile. But this is the one that I'll be suctioning with, and I'll be introducing into the airway, so it'll be okay. Okay, so I'm still sterile here. In order to create the suction, I have to put my thumb over this open hole right here. Okay. So before we start, I am going to test my suction with my sterile saline. Alright, so we are good to go. Alright, Miss Howard, so you're going to feel me insert this, and it's probably going to make you cough whenever I get to that point. So we're going to go ahead and start. I'm careful to not suction on the way in. We want to be gentle to those airways. So I'm not suctioning until I'm actually pulling it out. Alright, we're suctioning and twisting, getting some of that good mucus out. Your patient would usually cough. Okay. So sometimes secretions can be really thick, so we have the sterile saline here so we can clear our tubing out. Okay. So now I'm going to assess and see if she needs to be suctioned again, and I can do that by asking her to cough. Because remember, she can't speak, but she can cough. So can you please cough, Miss Howard? So I still think that there's some mucus still rattling in there, so I'm going to go ahead and suction one more time. So not suctioning going in, I'm going in about 10 centimeters. And okay. Great. Okay. So now that we are done with suctioning, I'm going to carefully wrap this up in my glove so we can dispose of it without those secretions exposing anyone else. Okay, so we're going to toss this in the garbage. Okay, and again, now is the time whenever I'm going to get my second set of vital signs to make sure she tolerated everything well. And then I'm also going to reassess her lung sounds and make sure they now sound clear rather than hearing any what we call rhonchi. That would be some rattling of that mucus in the chest. So that completes our procedure today, Miss Howard. Do you feel better? You just nod. Okay. All right. Thank you.